Gretchen Bachman. She is the team leader and senior technical advisor for the Orphans and Vulnerable Children team at the Office of HIV/AIDS at USAID. Gretchen has worked in the field of international development since 1993 throughout Asia, Africa, and the Caribbean, focusing on projects to improve the health and socioeconomic well-being of women and children. She is the co-chair for the PEPFAR Orphans and Vulnerable Children Technical Working Group, a leadership committee member of Together for Girls, and both a founding and steering committee member of the Better Care Network. Gretchen.
Thanks, Amelia. Mind if I just sit here?
That's fine.
I'm old. As Michelle reminded me. Remember when? No, at first, I want to give really huge thanks to Marcy Levy for taking the leadership and the folks at JSI and AIDS-Free on taking the leadership, and to Amelia, who is wearing every gender hat there is at the Office of HIV/AIDS right now, because putting together something like this it's a lot of work. And I was reading through it last night, just thinking about the meeting today, and I thought, oh my gosh, there's just so much in here that is great. And I think to echo what Michelle was saying before is I think from an OVC perspective that we definitely saw the pattern that the violence against children, and then that violence changes over the age span, so that when girls and boys, but girls primarily when they enter the adolescent years, that risk of sexual violence goes way up. And the services just really have not been there. But I think that the US government I think this has been a unique opportunity to work together on this issue. And I'll give you an example. Several years ago, I was in Kenya, and the Justice Department had hired a forensic nurse from the States to go to Kenya and train nurses and other medical personnel to deal with post-rape care. And I remember talking to her, and one of the things she said, I asked her about children and younger people and how that was brought in, and she said, we haven't really gotten to that yet. And I mean, not that, it's always like one step. And I think that this guide is one more important step. The first step that we started with was the more clinical guide. We worked with the International Association of Forensic Nurses to put that together, and with JSI as well. And I think the important thing to remember about that we can carry forward for this guide is that to give it legs, meaning to get it out into the field and used, we also sponsored and talked with countries about different opportunities to do that. So for example, we had a big meeting in Tanzania at the national level so they could come up with their own clinical care guidelines. And hopefully something similar around the community care side of this could be done. I also think that there may be opportunities to come up with companion training exercises and materials. We had the opportunity with a clinical guide to actually send, I am so loud, I don't know if I need this one. To send some of the forensic nurses to Swaziland to work with two of the major hospitals in Swaziland, and to really flesh out the clinical guide, but also do a lot of mentoring and training of staff there. So I think that this is just the beginning for this guide. There's really huge opportunities to build on it and get it out there. And I'm so glad to see so many of our partners here today, because I think that's really one of those opportunities that we can have, that this is just the beginning. As we always say, we don't want a guide that sits on the shelf. We want one that gets out there and really changes practice. I guess the only other thing that I would say is that this is, as we know, despite these really good steps that we've taken, a really nascent field. It's really, really in its infancy. And I have to say, I feel sometimes like it's hanging by a thread. I mean, I remember one of the folks who contributed to this is from Zambia, from the Livingston Center. I went to visit him at the center, and the guy who runs it, who's this really, really committed person, and he was battling with the hospital there about keeping the space that we had, rehabilitated with USG funds. Wasn't sure about where funding was coming for this or for that with government buy-in, and it's a struggle for these smaller organizations out there, and I just think we really need to keep our eye on the prize as far as those things go, to ensure that people are consistently funded. I also think that while the government's role and the state's role is huge, that we really need to look at the NGO side of this, because in my experience, sitting in a child probation's officer's office in Uganda, way out in the districts or the sub-districts, they'll get a report of a rape. They're the ones who have to go out and investigate with the police. They have to call, I remember being at one and they called Pathfinder to provide the transport. Not that that is ideal, but it really was some of the NGOs and CBOs who were helping coordinate. And I think the more we can get local CBOs the resources and know how to do that's really going to push us forward. Mm-hmm. So I'm sure we have lots of other people to give comments, so we'll stop there.
Thank you, Gretchen.